history of mental retardation and restricted joint movement, is brought to his primary care physician for a routine checkup. He is the full-term product of an uncomplicated pregnancy. A careful family history reveals that his parents are first cousins. On physical examination, he is noted to have coarse facial features and clouded corneas. Blood tests revealed elevated lysosomal enzymes in the serum. What is the significance of the consanguinity between the child's parents? In consanguineous relationships, there is an increased risk of a child inheriting the same genetic mutation from both of his parents. There is therefore a higher incidence of autosomal recessive disorders in this population. What is the most likely diagnosis? This patient is suffering from eye cell disease, which is characterized by coarse facial features, poor tone, kyphosis, and mental retardation. These children suffer frequent upper respiratory infections, pneumonia, otis media, and carpal tunnel syndrome. Death usually occurs in infancy or early childhood as a result of congestive heart failure or respiratory infections. Eye cell disease is clinically similar to Hurler syndrome, but presents with different findings at birth, including coarse facial features and restricted joint movement. What is the fundamental molecular defect in this condition? In eye cell disease, there is a mutation in the enzyme found in the Golgi apparatus that is responsible for adding a mannose 6-phosphate group to proteins destined for lysosomes. Instead of trafficking to lysosomes, these lysosomal enzymes are secreted from the cell, and high levels are found in the blood. Because the lysosomes lack the normal hydrolytic enzymes, material accumulates in the lysosomes and is not effectively broken down. What abnormalities would be evident by electron microscopy of cells in an affected patient? The patient's cells would contain many vacuoles. These consist of lysosomes filled with non-degradable material. What proteins direct movement of vesicles between the endoplasmic reticulum and Golgi apparatus? The Golgi apparatus is responsible for modifying many different proteins and directing their trafficking. COP1 proteins mediate retrograde movement of vesicles from the Golgi apparatus to the ER, whereas COP2 proteins mediate anterograde transport from the ER to the Golgi apparatus.